labor and delivery nurse, and let's go over what a fetal scalp electrode is. This is a method of monitoring baby's heart rate while in labor. An obstetrician will insert the fetal scalp electrode. So how they do it is they insert their fingers like you're having a vaginal exam done, and the nurse will pass them the sterile equipment, and they will find the baby's head through your vagina, and they will insert what kind of looks like a tiny little corkscrew. I don't know if you can see it here, but it's a little thin piece of metal that they kind of screw into the baby's scalp, and it monitors the baby's heart rate throughout the duration of labor. It sounds worse than it is. The reasons why we would use a fetal scalp electrode is if we are having trouble monitoring your baby's heart rate. Some reasons why we may be monitoring your baby's heart rate continuously is if you are on artificial oxytocin or Pitocin throughout labor. We need to be monitoring your baby's heart rate at all times while you are in labor on Pitocin. Another reason is if the baby's heart rate went really low or atypical, abnormal, and we can't pick up the fetal heart rate through the external monitors, we may want to insert an internal monitor to check on baby's health status. So we will only use this if it is absolutely necessary, but it is an amazing option to monitor baby's heart rate. You can still move appropriately throughout labor. This part here, this little string will be attached to the monitor, and it will just hang out between your legs. We will tape it on the inside of your thigh, and it will continue to monitor baby's heart rate all the way until they're born. And then as soon as they're born, we just untwist the little corkscrew that is in the baby's head. Risks of a fetal scalp electrode. Obviously, there are risks. Number one, you do have to be ruptured, so your water does need to be broken in order to use this, because you can't be going through the amniotic sac to the baby's head. You would break the water either way. It does also slightly increase the risk of cerebral or subdural hemorrhage in baby. So we do try to avoid using a fetal scalp electrode if we can, but there are situations where a fetal heart rate is non-reassuring or we are worried about it and we can't find it, and this is the option that we use to find the fetal heart rate. I have done lots and lots of deliveries as a labor and delivery nurse with a fetal scalp electrode, and baby has been just fine. So it is an option that is available and may be used during your labor. So this is good to think about if you are okay with this intervention being used while you're in labor and delivery. Talk to your healthcare team, because usually this is something that's used in the moment in an emergency, so you don't really have time to talk about it. So make sure you ask these questions ahead of time.